We all know that robots have been used in surgery. We've heard about that before. But did you know about the refinements in the detail of what robots can do and the way we all someday may just have surgery through our belly button? It's a long-standing source of laughter, the idea that aliens will come to Earth, capture us, and insert a probe through our belly buttons. Well, guess what? We've seen the medical future, and it's us. When 54-year-old Bill Suter was diagnosed with prostate cancer last month, he made some quick decisions.
I mean, first when you hear it, it's like I'm in denial. That's what I first felt, and then reality starts setting in. It's just something, it's got to be done.
Doctors told him they would need to remove the entire prostate, but instead of a traditional operation, he was offered the chance to make medical history at the Cleveland Clinic, becoming the 9th person in the world to have his prostate removed through a tiny incision in his belly button.
I feel like I'm pretty important to my family and my friends, and I don't want to lose that right now. So I feel this is the way to go.
Your navel is just skin and abdominal lining. The surgical cut about as wide as a fingernail. This means doctors don't have to cut through layers of muscle.
If we can avoid cutting through muscle, we can minimize the pain of the patient.
And it's not just prostate. Surgeons can now take your appendix out through your navel, perform hysterectomies through your navel, take out parts of the liver, lymph nodes, all through the belly button. And by the way, the robot can seal the organ in a plastic bag before it's removed.
Quite a medical feat, I would say.
Another breakthrough just in the last month, the addition of a new surgical arm that has lifelike finger controls so precise the robot can tie tiny knots in the sutures. Watch. Robot hands finally more precise than human ones?
I think we're at the tip of the iceberg. I think, the technology we have now is unbelievable.
And what about the new eyes in these miniature cameras? They're now in HD, magnified 10 times. Doctors seeing images inside the body so intensely, it's like seeing at 20 feet what others could see at 10.
Let me just point that out to you guys.
At NYU, Dr. Michael Stifelman can now see and remove a kidney tumor the size of a pencil eraser, which means he can leave most of the kidney intact.
The possibilities are endless, and it's just what we can create and to make us better.
A new generation of nimble, highly delicate machines that may make human hands a quaint artifact of the past. Who needs these exactly anymore when you can put them in and work them through a DaVinci robot? The surgeon you just met, Dr. Michael Stifelman, Director of Robotic Surgery at NYU Langone Medical Center, is here right now. Let me see if I understand this right. Less blood loss this way? If you do it this way. If you do it through the navel, you're not cutting muscle because the muscle's what's so painful when you cut it.
Absolutely.
And you can be out of the hospital in the same day?
A day or two. Patient-driven.
And there are about 930 of these in hospitals around the country
yes, they are.
Right now. Now, you were saying that it actually has less tremor than the human hand does. So these machines correct for any tremor that you might have in your own hands?
It's incredible, and that is absolutely true. The DaVinci system is built in, so even though the slightest tremor or a large tremor gets completely dampened.
And I didn't believe it when they told me you were going to peel a grape. But we have you with this instrument peeling a grape, little bitty skin coming. Look at that. Look at the fineness of that. Now, can you thread a needle as well?
Absolutely.
Are you going to do it for me?
I'm going to do it for you. I might have you do a couple of things, too.
Okay, I'm getting right here. I'm sitting down, getting myself ready.
So
you do not want to get your surgery by me today in the studio, let me tell you about it.
So here, look at the vision. I can zoom it in very closely.
Right.
I can grab this skin and gently I can peel this. Amazing, isn't that?
Astonishing.
Now imagine if you could take this technology and this vision and you can put it essentially anywhere in the body that you want to. Let me show you how we thread a needle.
Okay.
So this is the 4th arm. I'm releasing the grape. So again, it takes a 2-arm surgeon, and now I have 4 arms to work with.
Right.
And I can control the camera. I control 4 different arms. I'm going to grab this needle right here, this thread. I'm going to then place it into the needle.
Look at that.
And again, look at the visualization I have. Look how easy I can bring this up. And I must say, I'm a little nervous, and I'm shaking right now, but you can't see a thing.
Okay, what is it?
I'm going to switch it over to you. What I want you to do, since we're running short of time, I want you to actually work this. So I'm going to pass a couple instruments to you.
Oops, I squeezed.
So now, just squeeze.
Yeah.
Perfect. And now you can move. So let's go grab this rubber band right over here. There you go. You're doing great.
You got it.
Good. And you can put it anywhere. Put it right there.
All right.
And look at the tool consoles. We can work together. So you can have two surgeons working at the same time. So imagine I'm trying to teach you. I can help you.
I love this.
Isn't this great?
It's really an extension of your own arms, as if your own arms were a little more
We're a little
precise.
tiny, exactly. Yeah. And it really enhances the ability of the surgeon to do things.
Well, sorry, didn't mean to drop my instrument there. But I want to let everybody know that we're following something else that is new in robotic activity, and it's voice-activated robots to help people as if they were assisted living dogs.
Oh, that's a problem.
And Emory University and Georgia Tech have been working on these. We've just got a little preview. They're still working on them. At a voice command, the robot picks up a pill bottle, then a cordless phone.
People can have a life added to your life with a robot that can bring things for you and talk to you. It's brilliant.
You don't need to feed the robot. You don't need to take the robot outside. The robot's not going to be distracted by a steak.
And we've got more on all of this at abc.com. Of course, Dr. Seifman, thank you so much.
Thank you very much.